Hello everybody, my name is Amy Williams. I am a Senior Account Executive here at Oxford PharmaGenesis, and today I'm going to be talking to you about open access and specifically Plan S. So if you're looking for a bit of a kind of basic introduction to open access, or a more sort of general overview of open access, there was a very good presentation also on NetworkPharma from Liz Knowles from Taylor & Francis, so I would say check this out. This is specifically going to be looking at what the future has in store for open access and what Plan S means for industry. So that being said, I do want to just quickly do a little whistle-stop tour of what open access is. Now, I've gone for a very kind of lowest common denominator definition here. There are people who do not think this goes far enough. So the Budapest definition would not mandate there are more kind of sharing rights allowed, but fundamentally all open access definitions have this. They have the research paper available on demand, online, and free to all end users. So that's that. If you want to look at more kind of exacting definitions, the Budapest definition is a good one to check out. So in terms of, I don't want to go into too much detail, as I said, but these distinctions will be useful to understand what Plan S means exactly. So I'm just going to run over what these three distinctions mean specifically. So green open access is repository sharing. So you get your free copy of the article online from a repository posted by the author, so it's not free from the journal that it's published in necessarily. This is typically subject to an embargo period, so the author won't be able to post it online for about kind of 6 months to a year maybe after initial publication. So gold open access, on the other hand, this is the one that Pharma is typically using to publish open access at the moment. This is under a CC or Creative Commons license typically. And as you can see at the bottom, you've got some exciting definitions for some of those coming up. This is free from the journal's website to read, typically after the payment of an article processing fee or APC. So the next one you can see below here, this is some types of journals that it's interesting to look at. So we have open access, which, as the name suggests, fully open access. All articles in these journals are published freely available for everyone to read. Sometimes they charge open access article processing charges, sometimes they don't. The second middle one is hybrid, which means that you can opt to have an article published open access. So this will be usually you'll pay an article processing charge, and then if you don't want to pay that charge, you can have it paywalled accessed via subscription. And then the third one, you have the paywalled ones. This is only for subscribers or people who want to pay to access individual articles. So that's going to be an important distinction to bear in mind. The third row here is just a little bit of information on the licenses themselves. So these are the Creative Commons associated typically with the gold publishing. So CC BY means you need attribution for the author whenever you're reusing or sharing the material. CC BY NC means you have to attribute them. The reuse must be for non-commercial purposes. And then CC BY NC ND is so you have to give attribution, has to be for a non-commercial purpose, and no derivatives is what ND stands for, so you can't kind of chop it up and change it too much. So with that out of the way, on to Plan S. So Coalition S is a group of really quite major research funders. So this includes the European Commission and by extension the European Research Councils. Also Research Institutes UK. So this does not go away after Brexit in Britain. This is for the long term. And also 11 other national funding bodies, including France, the Netherlands, Sweden, although significantly not Germany at this point in time. Robert Jan Smits, who's been the kind of lead on Plan S and the spokesperson for it, has also been visiting the US recently, trying to advocate that funders in the US and across the pond sign up to this. So it's quite a big deal. There's quite a lot of quite a lot of research that are funded by these bodies. So it's important that we really know what this means, because I think it will be quite significant for our industry. So this is the top line statement that they've given. They want all research funded by these bodies to be published open access, and there's an important word here, compliant open access routes, by the 1st of January 2020, which is not that far away. So I'm going to take a look now at what compliant means. Plan S, as part of their press release, have released 10 principles that are sort of intended to guide how their open access policies are implemented by funders. So some of these are more relevant than others to us, but I'm just going to run through all of them for completeness, and then go into the implications afterwards. So from a costs perspective, the article processing charges must be covered by research funders, so no charges for authors, which is important, particularly in developing research nations, where sometimes the authors will have to shoulder the cost, so that's not going to be the case here. Article processing charges also must be standardised and capped, which is very significant. Obviously, at the moment, there's quite a lot of variation between journals, so they want to make sure they're all the same. Then the next, in terms of how they want their open access to be, I guess, authors retain the copyright of their work, and also they would prefer if the articles are published CC BY. So that's it's the most open, one of the most open Creative Commons licenses, and means that all reuse is available. So like data mining can use the articles, things like this. They also say specifically that green open access and institutional repositories are likely going to be an important part of delivering Plan S and meeting these targets. So they do specifically say that green open access is something that is compliant, provided there's no embargo period. There's also, this is probably one of the biggest ones I think for our industry, because we do in Pharma publish quite a lot in hybrid journals. Hybrid journals are not compliant. So either you need to be published in a purely open access journal, or in a journal that is subscription only, paywalled, with a green open access option. So that's going to be quite a big deal. So these ones are more funder related. So funders are obviously central to Plan S, as they're the ones telling people that this is what they want. So they do have quite a big role to play in implementing it. So funders have to work together to make sure the criteria are consistent. One of the complaints that we hear quite a lot at the moment is that authors feel worried that they have to be meeting all these different, if they've got sort of funding from various bodies, they have to be meeting all of these different policies. So there's a goal to try and make these all uniform. They also have to work with universities, again, to make sure they're aligned, so that everybody knows what they need to do to be delivering this. There's also, again, support for the green open access in saying funders will have a role to play in developing compliant platforms where there is an unmet need. So this is kind of advocating in the line of Wellcome Trust and Gates, which have, and a lot of others actually now, who have made their own platform, open access platforms for the research they fund to publish on. It's also up to the funders to monitor compliance and sanction non-compliance. So I think this is quite significant, because you don't know how they're going to do it, how stringent it's going to be, but there's a bit of an area of ambiguity there, but it will be the funders who are responsible for that. And then finally, and this is less relevant for science, but books and monographs may have a bit longer to go open access, because obviously it's a bit more of a shift. So this is quite a major plan, I guess. What do people think of it? So the advantages, that it's been positively received by quite a lot of people in the open access community and the open science advocates. It builds on the open access policies that have already been implemented by major funders such as Gates and Wellcome, and it they've worked quite well. They've been positively received. It takes those strong open access policies and builds on them. It also sends a clear message. So Horizon 2020 was released a couple of years ago. It said they want everything funded by Europe to be open access, but they didn't really say what they meant by that. There wasn't really, you got the impression that people weren't that worried about it or necessarily worried about not meeting it. Plan S puts a much more solid picture in place for funders and publishers and researchers to try and meet. It is also a bold commitment. It's a big major step. Hybrid journals are really popular. There's obviously a debate as to whether that's a good idea to say they're not compliant, but it's a big, strong commitment, and it's a clear push towards open access, which I think is quite important. It is also forward-thinking. So we've seen a lot in recent years. The funder platforms have been very popular, and it seems to be that that's a way that research publishing is going, so it kind of reflects that and is quite progressive. A lot of people have congratulated it for. But it is not all sunshine. There are also some criticisms, some of which do seem to be quite significant. The primary concern I've heard a lot, and you see in a lot of criticisms, is that it restricts researchers and authors' freedom. And this is particularly important for industry because obviously ICMJ guidelines state that everything has to be up to the author. It's quite an important value to have. So at present, hybrid journals published in a lot. There will be researchers who don't want to publish in them. They might want to publish somewhere that they can't. So that's going to be an issue. Also, particularly for medicine, society publishers and smaller publishers are really important to our field. They are threatened by open access, particularly models whereby if you have a high rejection rate, you get less reimbursement from open access than the APC model. So you need to work out how they can kind of navigate this, and it could be quite a threat to their business models. It also does kind of neglect the pressures on researchers now. So obviously, impact factor is still a big deal, whether we like it or not, and can make a lot of impact into a research career. So a lot of open access journals have lower impact factors. Researchers are worried again that it's going to negatively, they'll be sacrificed at the European Commission's open access targets, and they want to just get on with their careers, which are already quite tough. And then the final one here, which we've kind of alluded to already, is that there are significant areas of ambiguity. So it states a preference for CC/BY. What does that mean? Does that mean that you can just not do CC/BY if you don't want to? How do they interpret this? So Robert Jan Smits, who's the kind of figurehead of this, has said, these are our principles, make of them what you will, just make sure they get done. But some people are not necessarily too happy with that advice and want a bit more information on what they need to do. So, coming specifically back to industry, I think there are a few key points that should be brought out here. And they largely centre around how publishers respond to this plan. So one of the key concerns that we have is, will publishers continue to do hybrid open access, which could lead to increasing segregation between where the Plan S funders and industry and non-Plan S funders are published? Will there be separate essentially pharmaceutical journals and non-commercially funded journals? That presents quite a kind of potential issue, so that's something we need to be thinking about. Also, will it lead to higher article processing charges for industry? We've heard already that there can be higher journal charges. Industry do put up a lot of the money that keeps journals going. Will they have to shoulder an even larger burden as a result of Plan S, as publishers need to recoup their costs from elsewhere? The other thing is, will industry be expected to follow? So with some of the work we've been doing on the Shire open access policy, we've found the more authors know about open access, CC/BY, the more they want to be able to publish using it, which means that we want to make sure that authors want to work with industry, and if that this is obviously going to make them know a lot more about it, because all of their other funders will be using the Plan S principles. Will they be wanting publishing options that are not currently available to industry? And then finally, where does industry stand from a compliance side with green open access? Is it appropriate? Maybe not. With we don't know, and it's hard to find an answer from regulators on can industry share research in the same way as non-commercial funders? Where is it appropriate? Where isn't it not? So I think these are the main implications. I've now got just a few resources if you're interested in finding out a little bit more about some of this. So in terms of open access generally, the state of open access is a really good paper by Heather Piwar et al. That was released earlier this year. Gives a really good overview of what open access looks like in 2018. Then if you want to find out about the Plan S press release, you can find that online. That outlines the principles, gives more information on who all of the subscribers to it are, and stuff like that. We also have the Coalition S website, which goes into a bit more detail again, and then goes into kind of why this has been implemented. And then we also have, this is my favourite. There are plenty of think pieces on Plan S, but this I think is my favourite. It's from Peter Suber, who's a long-standing open access advocate, and I think he gives a very kind of detailed and fair critique of both the benefits and maybe drawbacks of Plan S. So thank you very much for your time. I hope you've enjoyed my presentation.